Good day, sir. I'm Chris Madutayo po, and your nursing aide for today. And today, I will going to perform colostomy care, changing an ostomy appliance. So, the purposes of this procedure is to assess and care for the peristomal skin, to collect stool for assessment of the amount and type of output, and to minimize orders for the client's comfort and self-esteem. And next for assessment, first we're going to determine the following. So, the type of ostomy and its placement on the abdomen, then the type and size of appliance that is currently used, and the spatial barrier that is applied on into the skin of the client. Then next we're going to review the stoma considerations for the color, size, and shape, and bleeding tendencies and healing status per client's record prior to seeing the client. Then for planning, assemble all articles or equipments and materials needed. Bring to bedside to save time and effort during the procedure. Then, next for implementation, we are going to close the room or the curtain around bed, to provide privacy of the client. Then, if the client is ambulatory, um, um, patient may be assisted to reach a bathroom in doing the whole procedure. Then, um, afterwards, wash hands and don gloves. Then next, we're going to assist the client to assume a position of choice, which is supine, side lying, or standing position, depending on the uh, client's mobility status. Then, if the client wears a belt, we can ask him or his permission to unfasten it so that we can proceed the procedure and the next step. Then next, we're going to remove the old colostomy pouch and wipe off fecal resides with a damp washcloth, while completely assessing the stoma and peristomal pouch with a skin integrity. We're doing this because sometimes the skin barrier may be left in the place if colostomy pouch is with a detachable place place faceplate. Then we're going to place a piece of tissue or loose pad over the stoma to protect from any something, and we're going to change it if necessary. And for any for ease and quick succession, it's best if we're going to prepare the peristomal skin, seal the skin barrier ahead of time before doing this one so that it will uh, make us move easily and prepare quickly. Then use the guide to measure the peristomal, uh, the stoma, and we're going to cut for the size and the open by the guide, while by putting it slightly over this one on the actual so that it will fit. Mm, got it. So after tracing a circle the same size as the stomal opening, we're going to size it this one. Next, we're going to cut out the trace stoma pattern to make an opening in the skin. Then after cutting this one, we're going to place it on the bedside for the meantime. Then we're going to wash the skin gently with skin cleanser or washcloth soaked with mild soap. And then uh, after wash cleansing it with soap and water, we're going to remove all secretions from the skin using a gauze or toilet tissue or gauze pad. Then next, rinse soap thoroughly and blot dry. Then afterwards, if blood appears when washing, if it was a small amount, it was normal. But if the blood is continuous or it has continuous bleeding, so it was abnormal. If that happens after the patch is in place, then observe condition of stoma, sutures, and encourage patient to make any some observations at home, such as if he or she feels irritated, and skin must be absolutely dry make use of paper on part of the skin or hair dryer. Just set in the cold to assist in drying to make sure that the stoma is dry before applying the pouch. Then have the colostomy pouch ready by removing backing from the barrier. Then afterwards, apply pouch to the skin after cleansing and drying the skin. And we're going to make it ready. Then we're going to hold it in place just for 1 to 3 minutes. And next, we can apply hypoallergenic tape. Um, we can apply hypoallergenic tape as needed to each of the face plate over the skin barrier if needed. And some pouches are manufactured with tape in place. Use tape may be optimal, but some are not. It depends on the agency or for the manufacturer. Then fold the bottom, the edge of the pouch over to fit clamp. This one. A secure clamp. Then we're going to dispose the old and appliance in the appropriate trash bin and remove gloves, then uh, wash hands. Then for evaluation, we need to note the appearance of stoma around the skin and incision if there is present, while pouch is removed and skin is cleansed. Report any deviation from normal findings to the physician. So while I'm removing it, the stoma skin is just normal stoma. Then for documentation, chart type of pouch and skin barrier, applied in nurse's notes, then record amount and appearance of the affluent in pouch, size of stoma, color, texture, and condition of peristomal skin and sutures. Then so the stoma, it should be red and moist, then and the size is round, then uh, there is no other things or adverse uh, problems other than that, and there's no bleeding happens during and after the colostomy care and changing the pouch. Overall, that's fine, and the patient feels relieved, and she has comfort after the procedure, making sure that it was clean and safe. That's all. Thank you.